Hello. So, yes, good afternoon. Welcome, everyone. Um, I am Christine Stewart, Senior Program Manager with the Institute for Public Health Innovation, and one of your co-chairs. Dr. Cooper could not join us today, so you just have me. But thankfully, we're in great hands, and I have Sinead by my side. Um, so if you haven't had a chance, and I see Sinead already invited many of you, please type your name and organization in the chat so we know who's here. And yeah, we'll get started. So, so the icebreaker for today is to finish the sentence. I know it's autumn when. So for those of you who don't know, so autumn starts Friday, which is well tomorrow. It's been a long week. So I know it's autumn when fill in the blank.
I know it's autumn when the leaves change yellow and gold.
Yes, although apparently because of climate change, some states have been seeing leaves change back in August.
I did notice that actually. Yeah.
Mm-hmm.
I can go. I know it's autumn when I can light my fire pit and roast some marshmallows.
Nice.
That's nice.
I'll go. I'm from New York originally, so I just have to say that because I'll know it's autumn when New York City is abuzz for Fashion Week.
Ooh. It's a good one.
I'll say I know it's autumn when we get to break out the fuzzy pajamas.
I love that. Although I wear fuzzy pajamas all year long. It's something about good fuzzy socks and good fuzzy jammies. You got to be comfortable all year.
I say I know it's autumn when you may have a short sleeve shirt in the morning, long sleeve shirt in the afternoon, in the evening, and a full jacket in the evening.
True. Any others?
This is Barbara. I know it's autumn when Starbucks starts to bring out their fall flavored drinks.
Someone the other day mentioned pumpkin chai latte or something. I'm sorry, I don't drink coffee, so I don't know, but I was like, that actually sounds pretty good.
I can go. I would say I know it's autumn when you hear when it's the air of football season and the traffic that comes along with it.
Yes.
I'll go next. I know it's autumn because I crave soups.
Ooh, that's a good one.
Ooh, what are your favorite soups? I'm curious.
Probably right now I'm really into a broccoli almost anything. But no, I could eat a pasta vajole. I could eat too. I mean, just to
Yeah.
Yeah, no, my old boss, just to hint with pasta vajole soup or any soup, actually, I've done it with any. He used to put in a little bit of balsamic vinegar, and it really brightens the soup up, you guys. So just think about almost whatever soup that you're having, just a tad. Okay, I add now more than a tad because I really like the flavor, but depending upon where you're at with balsamic, but it's wonderful. It just sort of brightens the whole thing up.
Interesting.
Yeah.
This reminds me, I feel like we've talked about having a health equity work group cookbook. We always end up talking about food.
It probably starts with me. Sorry.
I just made a big pot of chicken vegetable soup the other day. Oh my God.
Sounds wonderful. Sounds wonderful.
The next meeting is a potluck. Got it. Okay. Noted. Noted. Thanks, ladies. Any others?
All right. So today, so as typical as usual, we'll go through the work group vision, but today we're going to have a follow-up discussion to the meeting that to the presentation that we received last month on Medicaid cuts. And then we'll also be joined by the Integrated Maternal Health Services and have a presentation about that. And then, as usual, we are going to end with a slew of community announcements. That's another thing about fall. There are events every day. There are meetings, workshops, health fairs, and then we'll adjourn.
Yes, so think, oh, yes, here's a vision. Okay.
Yeah, so just to restate, the vision for this work group is that Prince George's County is a place where everyone has equitable access to achieve their full health and wellness potential, regardless of race, color, religion, country of origin, immigration status, class, age, disability, sexual orientation, gender identity, or health literacy skills.
Thank you, Christine. All right, so as Christine mentioned, for those who were with us or those who weren't, last month we had a very engaging discussion led by Ms. Stephanie Little, who was our previous Chief of Health Policy and Innovation at the Prince George's County Health Department. And she provided us with some really important legislative updates regarding federal funding cuts, particularly to that of Medicaid and the potential impact that those cuts would have or could have to our county residents. And so after she presented that summary, we then brainstormed collectively to essentially try to identify proposed action steps that we could take, which included developing a unified, clear, and health literate messaging. So making sure we are all speaking the same language to help minimize some of the confusion that exists with all the changing information and misinformation that's out there. Something else we talked about was empowering communities through culturally competent navigation support and training for CHWs, with health equity champions, and with health navigators. We talked about advocating at various levels by sharing stories of real impact. Like, we always have a lot of quantitative data, but let's talk about the qualitative data. What are the stories of the people out in these communities? How are these changes really impacting them? And hearing these stories can really make a difference and really encourage people to pursue action. And then the last thing we talked about was strengthening our continuity of care by leveraging existing networks and trusted community spaces. So we will be having some follow-up discussions to this, particularly as we prepare to develop our community health improvement plan, which we call our CHIP. So the idea is that we will most likely be integrating those work group discussions as part of identifying some of the priorities and the strategies and ensuring that there's cross-sector alignment. My team and I were working out the details now, but I do believe that this integration will probably include some level of discussion on ways to inform the CHIP priorities, ways to align work group goals, objectives, some of the action steps with the CHIP strategies, and even help identify who's at the table, who's not at the table. We talked about making sure everybody had a voice. So what work groups should be involved, what partners should be involved, or who are the community champions that are already involved, who are already doing this work, and who could be involved. Again, who should be at this table? We should all have an opportunity to eat from this table. So there is much more to come, but I did just want to give you that brief update to let you know that work and that conversation, it wasn't in vain. We see everyone's passion for this work and their readiness to take action. And we saw that also at our quarterly Health Action Coalition meeting. So we will be working together to make sure that we don't lose that momentum and that we work together towards that strategic alignment of our efforts. So more to come, but I did just want to give you that brief update. Okay, well, now I have the pleasure of introducing our presenters for today. We have both Annie Oley from Primary Care Coalition and Ms. Andrea Augustine from the Maryland Department of Health, who will share about the Integrated Maternal Health Services Initiative. But before they present, I'd like to share a little bit more about them. So Annie is a public health policy and operations expert with over 2 decades of experience. She is thrilled to have joined the Primary Care Coalition as the Senior Program Manager for Maternal Health at Primary Care Coalition, and she leads the Integrated Maternal Health Services Quality Improvement Project. She has extensive experience in government and nonprofit organizations, including the U.S. Food and Drug Administration, the Association of Public Health Laboratories, and the Maryland Department of Health. During her tenure at MDH, Ms. Oley held several senior leadership positions responding to the COVID-19 pandemic, managing agency-wide legislative and regulatory affairs, and directing the MDH healthcare system. We also have Ms. Andrea Augustine, who offers 15 plus years of experience. So our girls have quite a lot of experience between the two of them. And she's spearheaded complex sexual and reproductive interventions that promote health equity and social justice. She is the current perinatal health system specialist with MDH, and she drives systems level change to improve maternal health outcomes. As the former Assistant Vice President of Education and Community Engagement at Planned Parenthood, she produced high-impact programs and events that translated into actionable patient care. She also held several key leadership roles at the DC Department of Health. She led a citywide condom distribution program, and then at the Mid-Atlantic Patients Safety Center as a member of the board of directors. She holds a Master of Public Health from Columbia University and a BA in International Relations from Tufts University. And she is a proud native New Yorker, but she lives in Tacoma Park, Maryland with her family. So welcome, Annie and Andrea. I will turn it over to you, and if you just need me to advance the slide, just let me know. Okay. Welcome, ladies.
Great, many thanks. I really appreciate it. Every time I hear my introduction, I'm like, are they talking about me? Well, good afternoon, everyone. Once again, my name is Andrea Augustine. I am the perinatal health specialist with the Maternal and Child Health Bureau here at the Maryland Department of Health. And I work with Dr. Benjamin Wormser on the Integrated Maternal Health Services Initiative, also known as IMHS. I'm pleased to share this space here with you all today, as well as with my colleague Annie Oley of Primary Care Coalition, and to speak with you today about Maryland Department of Health's statewide strategies to improve health. Next slide, please. So here we have the strategy vision, which reads, all women achieve optimal health and well-being and have the agency to make choices regarding their bodies and reproductive and sexual health. As noted here, this presentation uses the term women, but we recognize and affirm the vast range of gender identities that people impacted by these strategies use, and they may not all identify as women. Next slide, please. So as reflected in our maternal morbidity and mortality statistics, birthing people across Maryland face significant and myriad maternal health. In fact, since 2010, Maryland has on average outpaced the United States in rates of severe maternal morbidity and mortality. Black and brown birthing people are disproportionately impacted, and these disparities are driven by pervasive social inequities. In response, the Maryland Department of Health launched the State Health Improvement Plan in September 2024. This plan, which focuses on 5 priority areas, the third of which is women's health, specifically focuses on maternal health and breast cancer. MDH's Women's Health Action Plan, which is sort of spelled out here on this slide, was launched in May 2024 and supports the State Health Improvement Plan's priority on women's health through its 6 key goals, which are, in short, to protect reproductive rights, advance birth equity, support behavioral health needs across the life course, improve access to somatic services upstream, increase community-centered approaches such as home visiting, and last but not least, to expand support and diversify the perinatal workforce. Next slide, please.
And Andrea, it seems like a few people are having problems hearing you, that you're fading in and out.
Uh-oh.
That sounds better.
What about now? Okay. All right. Let me know if that happens again. I'm sorry. Happy to repeat any part that was missed. Next slide, please. So the goals I mentioned moments ago are addressed across the 3 pillars illustrated here and in the next 2 slides. The first pillar is the foundation for health, which includes the provision of information and resources for birthing people. So you can see all of those listed in the boxes beneath. Next slide, please. The second is improving clinical care, which, as you can see from the boxes beneath the heading, such as improving care delivery, increasing access to group-based prenatal care, ensuring adherence to Maryland's perinatal system standards, etc. You can see that the focus here is on enhancing the quality of clinical care that is delivered. Next slide, please. And the last pillar, as you see here, is support and services. Based on some of the items listed below, you will see that this pillar emphasizes strengthening linkages to community-based care. Next slide, please. So this slide illustrates the current model of perinatal care coordination in Maryland. There are 2 key points of entry into prenatal care here that I'd like to illustrate, and they occurred through 2 key risk assessments. The first is the Maryland Prenatal Risk Assessment, for the MPRA, which is at the top to the right of the box, the pink box marked prenatal provider. And the MPRA is administered to all Medicaid patients at their first prenatal visit as required by law. The second assessment is the postpartum infant and maternal referral form, which is beside the yellow box that says birthing hospital. This form is also known as the PEMR, and it is administered to all birthing people within 48 hours of discharge from their birthing facility or hospital. As you can see from the box marked ACCU/LHD/MCO, both forms go through a distinct pathway, passing through one or more of these entities listed here. ACCU stands for the Medicaid Administrative Care Coordination Unit, LHD is Local Health Department, and MCO is Medicaid Managed Care Organization. And their passage through one or more of these entities ultimately results in what you see in the blue box, which is a linkage to for the birthing patient to customize care in their jurisdiction of residence at their city or their county. Next slide, please. As you can see here, care coordination in Maryland covers the prenatal to postpartum continuum. And it connects patients to various forms of care to meet their specific needs. So these can range from the social supports listed here, community support, behavioral health, and so forth. Next slide, please. So the Integrated Maternal Health Services Initiative, once again, also known as IMHS, is supported by a 5-year grant from HRSA, which was awarded to MDH in October 2023. It seeks to support care coordination for perinatal patients with maternal or infant health risks. It has 2 key goals. Number 1, to improve the rates at which high-risk patients, pregnant and postpartum people, are connected to perinatal care services in their communities via the MPRA or the PEMR. Goal number 2 is to understand the impact of improved use of this integrated system on completed referrals, engagement in care, and maternal health outcomes, including maternal mortality in Maryland. IMHS enhances perinatal care coordination system, the system in Maryland, by zeroing in on those specific entry points and pathways to care that are illustrated here and that are triggered by the MPRA and the PEMR. By converting those assessments from paper-based to digital, we have been able to streamline care coordination across all of the responsible entities, and as I mentioned earlier, link birthing patients to care in their communities of residence. Next slide, please. This represents our project deliverable timeline, We are currently nearing the end of stage 3, which is improving the PMER completion and referrals, from which we will move on to enhanced perinatal care coordination, which is really and continues system strengthening, and then end with a public awareness campaign. Next slide, please. This is an illustration of all of the various implementing partners involved in IMHS. Again, here at the center is HRSA, our federal funding source, which funds MDH. And in turn, MDH funds the entities listed here. These are Postpartum Support International, whose focus is on perinatal mental health workforce development. CRISP, which is our HIE, our Health Information Exchange, that has been responsible for digitizing the forms. Cardia Services, which serves as our program evaluator. Primary Care Coalition, with whom Annie works and is our quality improvement coordinator. They oversee the Perinatal Risk Advisory Working Group, which guides the work of IMHS more broadly. The Patient Family Caregiver Advisory Group, which is the voice of the birthing families that are impacted by IMHS, as well as they support the participating prenatal practices and birthing hospitals in adopting and submitting the EMPRAs, the electronic EMPRAs and PMERs. So as you can see, they have a lot, a large scope. Then we also support various jurisdictions in the implementation. So our pilot is spread across Prince George's County. There are 8 counties on the Eastern Shore. They are Caroline, Cecil County, Dorchester County, Kent County, Somerset County, Talbot County, Wycomico County, and Worcester County. And then we have Baltimore City, which recently joined our project earlier this year. The dotted line represents a non-funded partnership with Medicaid, but they function as a implementing partner with whom we work very closely as they oversee the participating MCOs that are involved in the care coordination that happens through the EMPRA. Next slide, please. That concludes my portion of the presentation, and now I would like to turn it over to Annie to discuss quality improvement. Thank you.
Thanks, Andrea. Hi, everyone. I just want to say thank you to a couple of folks who made this connection happen. So first of all, to Dr. Cooper, who I'm sad isn't here. It's always nice to see her, but she did extend this invitation to us, and we're really grateful. And I know that both Primary Care Coalition and MDH love any opportunity that we can have to promote this work and let you all know what we're doing. And also to Sharon Zalewski, who is on the call. Thank you, Sharon. Sharon has been working with us for the past a year or so to help us work with folks in Prince George's County, since you all are a huge part of the work that we are doing and really at the forefront of implementing these QI, this QI work that we're doing with MDH. Next slide, please. So just I think to reiterate what Andrea already said, here are our participating counties. So as she mentioned, we have several counties on the Eastern Shore, as well as Prince George's, and then it's not colored in on this map, but Baltimore City did join us as of July 1st, 2025. Next slide, please. Oh, and I circled Prince George's County because I figured you guys would like that. So here is a list of all of the partners that we are working with for IMHS. We are working with both perinatal practices in order to digitize the EMPRA form, as well as birthing hospitals for the PMER form that Andrea mentioned. Once again, I've just highlighted the ones that are particularly relevant to you, although I'm sure many of you have connections in other parts of the state as well. So in terms of our partners for the prenatal care practices, we're working with FQHCs to start, and then we will expand to other types of practices who see patients who have Medicaid. But for now, in Prince George's County, we are working with Greater Baden Medical Services that I actually just visited last week, their Brandywine location, and that was really interesting and very cool to see how they're implementing this project on the ground, as well as CCI Health and Wellness. And then in terms of birthing hospitals that have Prince George's County patients, we are working with Holy Cross, MedStar Southern Maryland, and UMD Capital Region. And UMD Capital Region actually was our very first site to submit digital PMERs, the postpartum infant and maternal referral forms. So we are especially grateful for them for diving right in and going first. All right, next slide, please. So just to give you a little bit of an idea of what we've accomplished so far. So we are in Q1 of year 2 of this grant. So for year 1, we were really working on kind of getting the lay of the land, seeing what our baseline was, talking with providers, with MCOs, with local health, our local health department partners, everyone to do a CAP assessment, which is knowledge, attitudes, and then practices and procedures. So that included several key informant interviews, and I'll talk a little bit about what we found briefly later in the presentation. We also created our 2 oversight groups, which is the Perinatal Risk Assessment Working Group, the PROG. That one has one that kind of just an acronym that kind of rolls off the tongue. And then our Patient Family Caregiver Advisory Group, which doesn't have that kind of acronym, but the PGHAC, I guess we'll call it. And then we also established QI support pilots around digital form implementation. So the digital Maryland prenatal risk assessment form launched in April of 2025 after preparation, and then the PMER actually launched July 1st, 2025, excuse me, but obviously there was quite a bit of preparation to lead up to that in year 1. So what PCC is doing is providing technical assistance and training to the individuals at these practices that are using these forms. Obviously, we're working very closely with CRISP, since they are the ones who have created these forms. And so we are working with them as we get folks onboarded, and also making sure that integration with the EHRs at these sites is seamless and complete. And finally, in year 1, we established MOUs with our clinical partners so that we know what we're supposed to be doing, they know what they're supposed to be doing, and we can make sure that these relationships are, functioning to the maximum of their capacity. So for year 2, I can't believe it. I know someone already said this, but I just, it's sort of blowing my mind that we are coming to the end of Q1. So what we've done in Q1 is we've increased focus on improving workflows to streamline the implementation of the digital EMPRA and PMER forms. So, now especially the EMPRA in particular is working really well. Folks, we actually are very excited to be able to share that our 4 perinatal sites are submitting 100% digitally, which is a huge milestone. So with that, we are sort of shifting to kind of what does it take to get you to be able to submit digitally, and how can we streamline that process? Right. And what's interesting is in the 2 sites that we visited so far, the workflows that they are using to get to the point of submitting the EMPRA form digitally are completely different. They've arrived at different ways that work for them. So as we start to gather best practices, it's been really interesting to see so far, like just how differently people have found ways to go about it. In terms of the PMER forms, we are making great strides. We are definitely at the point where folks are being able to submit reliably. And as we wrap up any last final technical things, we'll do something similar with the birthing hospitals, to start looking more closely at their clinical workflows, et cetera. We are also working with the PROG to develop a definition for the ideal perinatal care coordination system, because really the point of all of this is not just to make everybody really good at submitting the digital forms, although that's a plus, but how does that really enhance perinatal care coordination in Maryland, right? How does it enhance the relationships between the various stakeholders, et cetera? We are enhancing recruitment of regional clinical dyads to support this care coordination. So these are individuals, doctors, advanced practice nurses or nurses who can work with us to really champion this program in the region. So on the Eastern Shore or in the DC metro area, and then in Baltimore City as well. So if you know a clinician who is really excited about perinatal care coordination, please send them our way. So we would love to have more folks involved. We are also working on distributing funds to our clinical partners. So we have support fund stipend agreements now set up with all 4 of our perinatal practices, and we are going to begin working on setting up those agreements with our birthing hospitals as well. And these funds are intended to support staff time, any changes to the EHR that might need to be made for the digital form integration, and really anything that supports this work within the guidelines of the grant. So obviously we are working very closely with our MDH counterparts on that as well. So as we move into the rest of the 5-year project, obviously we'll be participating in many of the things that Andrea mentioned, but in particular, we're going to be recruiting more practices, and then I think eventually hoping that this will be statewide at some point. And to that end, we are developing digital EMPRA and PEMR toolkits so that as practices are onboarded, they will have what they need to get started and just go off to the races. Be establishing a sustainability plan so that this work can continue after the HRSA funding is no longer available. Be finalizing the toolkits and disseminating the findings, and hopefully we will be enhancing perinatal care coordination across Maryland, because really that's what all this is about. Next slide, please. So the PROG, the Perinatal Risk Assessment Working Group. So this is a big group, I will say. It's really wonderful to have so many partners at the table and so much expertise and experience. So this is a monthly meeting at this point, and it convenes all the IMHS partners. And so we are very excited to have this group working with us on state level collaboration, sharing best practices, and looking, I think, forward to what we would like our target completion rates and improved workflows for all stakeholders involved in this process to be. So just for some examples, we have prenatal care practice staff, birthing hospital staff, local health department staff, health department ACCU staff, MCO representatives, obviously folks from MGH's Maternal and Child Health Bureau and the Medicaid, and then also representatives from our patient and family caregiver group. We actually, in our last meeting, we had several members of the PGHAC participate, and it was so great to get their perspective on what was discussed in terms of the year 1 findings, which Cardia presented, but also just to kind of get either confirmation or maybe, some more sort of on the ground information about what, all of us sort of from this perspective are discussing. Next slide, please. Okay, so our patient and family caregiver advisory group. So we are continually recruiting. So I am not above a sales pitch, excuse me. We are continually recruiting individuals for this group. It's actually a paid opportunity. Individuals receive around $100 per hour for participating in the group. We're looking for folks who are less than 1 year postpartum, who, you know, had a EMPER form filled out for them. So they were patients with Medicaid, you know, and then, or, you know, had a high risk pregnancy identified at the hospital in a, which triggered a PEMER form. So if you know anybody who fits that description, we would love to have them send them our way. We're always looking for more voices here, and obviously the more diverse voices that we can have would makes this an even more enhanced discussion. We are working at the moment also to see how we might best facilitate a Spanish-speaking version of this meeting, because we know for a lot of folks that, you know, English is not their first or preferred language. Alrighty, next slide, please. So just briefly on the CAP assessment, which we will be updating this year to see what has changed, and we'll be doing subsequent updates through the course of the project. So PCC led this CAP assessment to better understand, you know, what the current prenatal risk assessment environment looks like through key informant interviews and qualitative data collection. So some examples of folks that we interviewed were clinical staff, so the staff at the practices that we are working with, as well as some other folks, LHD staff and ACCU staff, MCO staff, and we also interviewed some patients impacted by the perinatal risk assessment system. Next slide, please. So obviously this is, you know, a long report, and there's lots of additional information that certainly we could provide, but very briefly, you know, the common themes that came up in this assessment were provider challenges with form submission, accuracy and timeliness of form completion, and there are some rules around when forms have to be completed. And then finally, communication challenges across the systems, right? So even beyond the submissions of the forms, just, you know, connecting with other resources, clinical partners, et cetera. Next slide, please. And I think that's it. So thank you all again so much. We are more than happy to take questions, also to hear your thoughts on any of this. And both Andrea and my contact information is here for you should you want to follow up with us afterwards. And again, I would just say thank you so much for this opportunity. And I will turn it over to Andrea for any final comments if she has any.
No, I just want to reiterate your thanks and gratitude for the opportunity to be here and share with you all, and happy to take questions as well.
Thank you both for that presentation. It's very informative, and it's always great to see what's going on in our community. So, and I see a comment in the chat, great presentation. So at this time, we'll open the floor, the meeting room, and the chat box to you all if you have any questions, comments, thoughts. You can unmute yourself, or you can type in the chat box.
Well, while we're waiting for others to make comments or ask questions, I did see that, I mean, I heard, Annie, I heard a call to action. If there's anybody that we know that fits the description of somebody that would be able to participate in the patient, family, and caregiver advisory group, to let them know or let you all know. Is there information that we can pass on to individuals, or a way to give them information about this work group?
Absolutely,
Advisory
and
group.
I will give that to Sinead to distribute to all of you. Let me make a note.
Wonderful. All right, thank you.
I know that
You-
some providers actually have a little flyer that they include in their like sort of materials that they give out. So I want to make sure you have access to that.
Thank you.
So my question is, I'm Arlene Orantes. Do you need people that speak another language, like Spanish or other language that can be like an advisory group?
So in terms of the patient and family caregivers group,
Mhm.
we certainly welcome members who speak other languages. I think so. We contract with a with sort of an interpretation translation service, but because we have so many folks who speak Spanish, we're just on the PCC side, kind of behind the scenes, trying to figure out if there is a sort of more natural, better way to facilitate. Because as wonderful as an interpreter is, you know, it's always nice to have the conversation flow sort of more naturally. That's all.
I completely understand. Yeah,
Mhm.
yeah.
But
Thank you.
yes, please. You know, and again, really, we're looking for as many voices from as many different backgrounds as possible. So we will make it work.
Yeah, what day and what time is the advisory group meeting?
So we don't have our next one scheduled yet because we're still trying to put together our next cohort. So again, I will get the information out, and then of course we'll also let you all know once we have our next date.
Okay, thank you.
Thank you.
And related to that question, are there populations or groups who are maybe not as represented in the advisory group right now that you'd like to see more of, that, you know, those of us who are working with community members can help in the identification for?
So I think specifically what we're looking for at this point, and then Andre, I see your hand is raised. I give you a chance to speak as well. But you know, in particular, we're looking for folks. We have some wonderful members right now, but we are looking for folks who are less than a year postpartum and who were Medicaid patients, essentially, so that, you know, they went through the EMPRA process, because we're really looking to see if what they're experiencing matches what it is that we think is happening, right? You know, so we've had lots of folks, or I wouldn't say lots, so we've had a lot of different folks, but you know, they didn't necessarily sort of participate in the process all the way through. So you know, specifically, if you know folks who you know, went through the EMPRA process at you know, their first appointment, that would be in particular very helpful. Go ahead, Andrea.
Thank you. Can everyone hear me? Just want to make sure this sound is okay.
Yes.
All right.
Yes.
While if any other questions may come up, by all means, please still feel free to throw them at Annie and or me. But I also wanted to take an opportunity to mention that one of our program vendors, Postpartum Support International, whom I mentioned earlier, that is focused on the perinatal mental health workforce development. They offer the first perinatal mental health certification as a professional certification of its kind. It is available to clinicians who are in mental health, psychotherapy, psychopharmacology, or affiliated professions like peer supporters, doulas, community health workers, social health workers, etc. And I wanted to mention that they are having a training for perinatal mood disorder components of care training coming up in October. and it is for providers that deliver services in Maryland only. So they don't have to live in Maryland, but they have to provide services in Maryland. And it will be at the Hyatt Regency in Baltimore. A scholarship is available to help with payment assistance. So I just want to put that in the chat and ask if you all would kindly share it with folks who may be interested in pursuing this certification to support their work in perinatal mental health. So I'm just going to drop it in the chat. If you have any questions, you can reach out to me, or you can reach out directly to Postpartum Support International. Their contact information is going to be in the announcement that I am about to share. Thank you.
Thank you. There was a question from Lisa for the Spanish facilitation. Have you reached out to CHW groups or maybe Coaching Salud Holistica? And Annie responded, yes, we're considering those groups. I did have a kind of a random question related to this, but in some of the conversation that you're having with the advisory group, is there much mention of doula support or the need of doula support or any issues accessing that kind of support? Because I know doula services are becoming more desired, more popular, similar to CHWs. So I was just curious if you're getting any feedback in that regard.
So I can start, and then maybe Andrea, you can chime in with whatever I've missed. So actually in our, not this past, the prenatal risk assessment working group, but in the two before that, we really did a deep dive into what an ideal perinatal coordination system would look like, right? And as part of that, we really thought about not only the definition, but what the components of that would be. So we had several categories, of specifically clinical care to social support to other kinds of wraparound service needs like mental health, as Andrea was just mentioning, and doula support absolutely came up as something that was desired and needed. So I think we are discussing that, and also looking at it through the lens of new rules around it as far as how services are offered, how they're paid for by insurance, et cetera. But it's definitely on the table as a need for sure.
Yeah, I would just echo what Annie said pretty much, and just say that one of the, yes, it is in greater demand. As mentioned earlier, I think one of the challenges that we do.
Oh, Andrea,
we're losing you. Your voice.
Here it goes again. I don't know why that's happening. I was saying that one of the challenges with the doula program with respect to consistent integration in perinatal care coordination across the state is access, particularly in some of the more rural counties, where there's just a scarcity of providers, and access to all different kinds of care is very limited. And so while doulas are a great source of care, we still have a lot to think through in terms of the access piece.
Thank you for that. Any other questions? Just put your contact information up again in case anybody wants to follow up. And I'll make sure to share this with the follow-up email with the meeting presentation and the slides and the announcements as well. I'll make sure to include the contact information. Sharon, I thought I saw your hand. Sorry.
Yes, I had a quick question. Can you talk a little bit about what the genesis of this program, why did this program begin, besides just the funding, and what was the impetus for that, and including Prince George's County in the first go around?
Sure. So some of the things that I can say, and to be in full disclosure, some of it predates me, so I will not have all of the information, but I'll do my absolute best, is that the EMPRA in particular is legally required by Medicaid law, by COMAR, as mentioned earlier, to be administered to all Medicaid patients at their first prenatal visit. But what we found was that it is not always uniformly done. There's variability across the state in terms of the submission rates, and we also see vast variability in the PEMR submission rates, even more so, where you can have some facilities submitting or some counties receiving as many as hundreds and others receiving in the single digits. That one is not required by law, so even more so, you see a lot of variation. And so this initiative is really designed to address some of that sort of fragmented approach to the administration of these risk assessments, and to really use those as a way to strengthen the systems of perinatal care coordination across the state. The impetus to include Prince George's County, unfortunately, that piece I could not necessarily give an informed response other than to say that I know that they were just part of the pilot. So I imagine that there was agreement to participate or something else, but I'd be happy to explore that further and get you more information about that. But like I said, I came in after that had already happened, so I don't really know the full story. Does that help at all?
Yes, thank you. I was just trying to get at whether it was because of Prince George's County having a fairly high rate of maternal and child morbidity and mortality compared to the rest of the state.
It could be. I mean, you see a lot of statistical variation in terms of in those terms, but thankfully, Ben, my manager and the person who directs IMHS, is about to jump in and help. So Ben, take it away.
Oh, yes. Hi, everyone. Ben Wormser. I'm the medical director of the Maternal and Child Health Bureau. And thank you to Annie and Andrea for your presentation. I just wanted to confirm that, yes, it is partially because of the maternal morbidity and mortality rates in Prince George's County, and also the infant mortality rates in the county. But with the added caveat that when we were this is a project that we wanted to do for a long time. The grant that came from the federal government was just an opportunity to finally do it. The perinatal care coordination systems that Andrea and Annie described have sort of iteratively been developed at the local level, but never with full sort of statewide organization and infrastructure behind it, besides the paper forms that were being faxed around. And so when we wanted to move to a digital system and really look into coordinating the perinatal care coordination, we wanted to do the pilot project both in sort of a densely populated area where we know that there is maternal and infant morbidity mortality, and then also in a more rural area, which is why the Eastern Shore was selected as the other side of the pilot project. Feeling like if we could design a system that worked well in both of those environments, and with the many communities that live there, expanding it statewide, which is the ultimate plan, would be an easy next step. And I should also say that we have really amazing partners already at the Prince George's County Health Department and in many of the Prince George's County hospitals and prenatal practices, which also made it like a really great place to leverage those relationships to hit the ground running.
Thank you, Ben.
Thank you for that. Any other last minute questions?
Yeah, so I mean, and thank you for all this information. So this is very new to me. And there were a lot of acronyms. So so bear with me while I just ask for a little bit of background. So it seems like this is a project that was really geared at getting those forms filled. My question is, how does that information translate? How is it used from those assessments? How is it used to improve equities, as this being the health equity work group? How is that information then passed on to those who may be able to make improvements on the community level, if that's part of your scope.
Yes, it is part of the scope. And thank you very
Okay.
much for that question. So what ends up happening is that by digitizing these two assessments and having a platform where we can trace the entry of the patient into care coordination all the way to the end, to see that the desired state that they've completed all of the care, or maybe they've disengaged themselves or what have you, we have access to patient level data that can tell us those experiences that we can disaggregate by various categories, by race, ethnicity, age, et cetera. So we can really kind of do a deeper dive into the data to see if and where those disparities exist. And so based on that information, sort of mount a response to those disparities. And we can also see it by jurisdiction, reasons for people not engaging in care, or reasons for them not obtaining services. So we could see a whole host of very valuable data that gives us really deep insights into that care coordination experience, and the ability to be able to break it down into different categories of data are where the health equity approach really comes in. Is that helpful?
Absolutely. Thank you.
You're welcome.
I would
So-
also just add that, sorry if I may, I would also just add that, in digitizing these forms and also really digging into the clinical workflows behind them, trying to streamline the process as much as possible, and trying to make it as easy on the providers as possible to provide this information, right? The more likely it is that, these forms are going to be filled out, and they're going to be filled out, for everyone for whom it's appropriate to have them filled out. So, I think, I sort of think of it like, the digital form implementation is a micro change that will have a macro level, impact. That's the hope.
I think that was very important to state, Andy, just to have, I'm a big picture person, so I love that I was able to, that framing was really helpful to me, because yeah, sometimes people don't understand why am I doing this small change, and they don't understand how it rolls up and has a bigger impact. So thank you. Are there anybody else have any other questions? Ninfa?
Hi, sorry, I don't use Teams often, so I'm like trying to find my buttons and trying to turn my camera on. There we go. Good afternoon. My name is Ninfa Amador, and I'm a policy manager at CASA. And today has just been like a healthcare filled day for me. And I'm ending it with you all, and I'm glad I am, because the past like 4 hours have been cruel, with a lot of changes coming down and Medicaid, through the private exchange as well, and our state acting in ways that that is really detrimental and impactful, not in a positive end for the communities that CASA serves. So CASA is the county and the state's largest immigrant services and advocacy organization. And healthcare has definitely been a priority topic for our members, because many of them, their immigration status precludes them from being able to access like the healthcare insurance that maybe you and a lot of you have access to because of our immigration status. So I'm really curious to hear from like a service provider point of view, from the two presenters, if y'all have seen a decrease, or like what impacts have you seen with the immigrant community that you serve due to the climate that we are currently in?
Thank you. If I can start, Annie, and then please feel free to chime in. So we meet regularly with the local health departments that are piloted and participating in this program, and we hear from them directly, because my position and the position of the program is not direct service, but the LHDs, for lack of a better word, local health departments, are really the ones that are involved in the care coordination at the ground level. And they have spoken up a great deal about their concerns for the community impacted the And so one of the ways in which we have tried to work with them is to kind of problem solve and think about strategies of engagement. Because of course, if they or their staff go out and identify themselves as government workers trying to engage people in care, that's an automatic barrier to engagement. People are afraid, people don't want to hear that. And, it's just a lack of understanding of how, on their side, sort of how it's perceived as a government worker going out and introducing yourself as such. And so we've really gotten into some deeper dives with them and sort of the provision of technical support to kind of think through strategies to rethink how you do outreach in the community. Because people still need the care regardless, but we have to think about what is the face of that care and can we change the face. We also have to think about language access still, and making sure that some of the LHDs can work together where you see one LHD says we have, materials, promotional materials in one language in particular. And then I'll hear another LHD say, hey, we have this growing population of this particular immigrant community, but we don't have, the language abilities. Then you connect the two so you can share resources, maximize your resources, but then therefore you can help one another to expand your outreach and your language justice, language accessibility. So, I mean, there's myriad ways that we have tried to think through some of these challenges presented. It is a very difficult and unique challenge, but we're also very thoughtful about, patient confidentiality and things of that nature. So we continue to try to work very closely with all of our implementing partners to strategize on this. But those are the top two levels that come to mind, just, end of day fatigue for how we have really tried to make sure that people still feel comfortable in accessing the care that is being. I hope that answers.
And I would just add, well, first of all, just to reiterate what Andrea said, we've heard the same thing from our clinical partners, both on this program, but also generally. So Primary Care Coalition has a whole other side of it. I'm on the population health side, but then we have a healthcare access side with clinics, that actually see patients, et cetera. And we are seeing, I have anecdotal evidence, unfortunately not anything concrete quite yet, but we are seeing a decrease in utilization of the healthcare services that we provide directly, as well as, hearing from, our clinical partners on this project saying that they are also seeing a decrease in folks coming in, I think because of the fear essentially that you're describing. And I think, one of the things that I think we really want to dive into more, with our groups, but, just also in general with the practices and with the local health departments and with MDH, et cetera, is, how can we make sure that, that we can provide services in a way that make people feel safe? And what does safe even mean now, right? Because safe means something different to different folks. I know, Andrea, you brought up, some really good information about that at our last meeting. So, I think we're all very, very much aware that this is a real problem and that we really need to be creative in our solutions. But we are at the very beginning, I think, of this conversation for sure.
Thank you so much for sharing that.
We're always on the lookout for additional ideas and strategies and resources. So then, but if you at CASA have some, ideas or approaches that we could share, I'd be happy to be a conduit of that information, because I know CASA quite well. So
you all do amazing work.
Yes, absolutely. So, if there's ever an opportunity or, just if you have resources or anything, ideas, approaches, what have you, please feel free to share them with us and we can communicate those to the folks that are doing the work at the ground level. Because, my knowledge is limited and we're all trying to figure this out as we go along. It's such a ever-changing landscape. So we're always open.
Definitely. And 100% what you all have shared is definitely what we're hearing. and it's a pattern not just in Maryland, like across the nation, right? Healthcare providers, services providers in general are seeing a decrease in folks attending to these services. Two things I would say on the resources end. If you all haven't already seen the guidance that the Attorney General put out per HB 1222. HB 1222 is a Maryland Values Act that includes sensitive locations policy language. This is a bill that our community really worked hard to get across the finish line during the legislative session this year. And this bill particularly talks to essential care providers and how they can at least try to make their physical spaces more protected in terms of like ICE enforcement, and when and where ICE agents can enact ICE enforcement in a building, in a space that's meant to provide essential services. So definitely take a look at that. And we're really urging anyone with a physical space, even if you don't have a physical space, to share this out with your networks who might have physical spaces, to create private areas where you clearly have it labeled only staff beyond this point, only certain people, so that we don't have these instances of ICE trying to do a raid without the valid documentation that they clearly don't have, but they are trying to bully themselves into these spaces to attack our community members. But we have to remember that there are ways that we can assert our rights, and in this case, like assert states' rights. And that guidance by the AG really digs deep into all of that. So take a look at that if you haven't already. And if you have any questions regarding how to like implement some of that, feel free to reach out. We are trying our best to support those of you providing essential services to our family members and our community members. So we'll definitely try our best to see how we can support any of those questions. And then secondly, this goes to like the access to care piece. Now I'm gonna put the rest of this in the chat, but I just want to flag that there were opportunities that people could get access to care that are not being supported currently by our resources at the state because of the impacts that are coming down from the federal administration, primarily through HR 1, which is that big ugly bill that is attacking our communities instead of supporting them. So keep that in mind. And if you all are able to support our advocacy on that end, once we have like more structure on what's going on, as I said, I'm just learning a lot about this today. So you're kind of getting my reaction and how I'm processing it live. So I appreciate you all holding the space for me during this. So I put the rest of that info in the chat, and I just wanted to pitch that to you all as something that you can look towards. And if you are able to support, I definitely urge you to join us in this fight to protect our immigrant families' access to health care.
Thank you very much, Nympha. I appreciate it. And I wrote down the bill, HB 1222. It's an Attorney General's guidance. I will look into it and see what we can. Thank you so much.
Great. Well, thank you again, Annie and Andrea. This was a wonderful presentation. Again, great work that you all are doing. And it's always great to discuss ways that we can collaborate with one another, that we can partner with each other. So again, if anyone has any follow-up questions for Andrea and Annie, please feel free to contact them. I'll make sure to send out the slides that has their contact information on it. And if you have any, Andrea, if you have any questions for the work group that you want me to pose or to extend to the group, please let me know. I'm happy to do so as well. So thank you again. This was a great presentation.
Thank you. Enjoy the rest of your day.
Thank you, everyone.
Thank you.
Bye.
Good night, everybody.
So I'm going to go ahead and share our community announcements for the month. There are quite a few, so just bear with me. But first we have we're coming down to the wire here. We're at the end of our Prince George's County Health Department back to school vaccine clinics. I think the last one is the 27th. So again, we just appreciate you all sharing this information with your colleagues, with partners, with community members to let them know where these vaccines are being held. So again, I think the last one is the 27th. The Walk to End Alzheimer's is almost here, so you all can join Prince George's County, the Healthy Revolution team. It will be this Saturday, September 20th at the National Harbor to help raise awareness, support caregivers, and to fund Alzheimer's research. I do believe registration starts at 8:30 and the walk begins at 10. So feel free to join us, bring your comfortable shoes, your water, a snack, and a friend, bring your dog, and get moving while we all support this really, really good cause. Hope House is a proud sponsor of 100 Black Men of America's Breaking the Silence, Black Voices on Suicide and Survival. They are asking that you all join them on September 24th at 6 p.m. for a Zoom panel discussion that will just look at the factors that contribute to the alarming rise of suicide among Black men specifically. They'll talk about ways to break down the barriers that prevent them from seeking mental health care and talk about ways that they can really just break the cultural stigma that exists in the community. So the link to register is on the slide, and I will make sure to send that out. Prince George's County will also be having their 2025 Family Caregivers Conference. It will be Thursday, September 25th. At 10 a.m. The registration link and flyer are on the slide. I will make sure you have it. The event will take place at Martin's Crosswinds in Greenbelt and is open to those who care for older adults or individuals with Alzheimer's disease or related dementia. They wanted me to note to you all that registration is required due to limited seating. So I think they're coming down to the wire as far as how much availability is left. So if you are interested, please register. MedStar is excited to launch a safe space to support individuals and families that are affected by diabetes and will help to just better promote healthy coping strategies, enhancing self-management, and fostering meaningful relationships with their healthcare providers as well as fellow support group members. This support group meets every third Wednesday of the month, and they changed the time starting this month. So now they will meet from 11 to 12. MedStar Health Advisory Task Force. They're inviting us to join their advisory task force meeting for MedStar Southern Maryland Hospital Center. Their ATF brings together community and partner resources to support the implementation of their community health needs assessment, which many call the CHINA. During this meeting, they will be reviewing their implementation plan. They will highlight the progress that they've made so far and explore opportunities to strengthen collaboration. So they are going to meet virtually on Monday, the 29th at 4 p.m. The link is provided. Parks and Rec is celebrating Walktober. So please join them as they celebrate pedestrian safety, health, and community options for this month. There are going to be a variety of events for people of all ages and abilities that you all can attend to get moving. So please visit their website and you can check out this flyer for a list of events that they are sponsoring. They are also observing Mental Health Awareness Week starting October 5th through the 11th. Again, they're just asking that you visit their website to learn more about the mental health resources in Prince George's County and to gain knowledge on how to care for your mental well-being. They're going to offer free workshops, free fitness classes, and some other trainings as well. So go ahead and click that link if you want to learn more. Step It Up Walk Maryland Day. So celebrate Maryland Walking Day by walking or rolling a few laps around the beautiful loop trail at Tucker Road Community Center in Fort Washington. This will take place on October 1st at 4 p.m. You can register to attend. They're going to have urban line dancing, and then following that, they're going to have a guided walk around the trail. So sounds like a lot of fun. So if you're available or you know someone who might be interested, please feel free to share this information with them. Girl Group will be hosted by Presley Counseling and Wellness to offer a safe and supportive space for young girls to build confidence, resilience, and connection. They're going to have guided discussions and lots of activities for the young ladies when they meet on October 4th at 12:30 in Fort Washington. Medicare open enrollment. This is going to be hosted by Prince George's County State Health Insurance Program. This event is a wonderful opportunity for people to learn more about their Medicare benefits, how to complete a benefits checkup. They'll receive one-on-one assistance and discover ways to save on healthcare costs. This event will take place on Friday, October 10th at 10 a.m. at the Health and Human Services Building, Capitol Heights. And on the note of Medicare, Dr. Gaskin from Johns Hopkins University Bloomberg School of Public Health is looking to speak with Black Medicare beneficiaries. They're going to have a 30-minute phone interview and really just a conversation to understand what influenced their health plan selection. So if you or someone you know might be interested in participating, please feel free to share this informational flyer with them. There will be a $25 gift card incentive available to those who participate. All right. In honor of National Substance Abuse Prevention Month, Therapeutic Links is hosting their One Future, One Voice Youth and Prevention Town Hall on Saturday, October 25th from 10 a.m. to 2 p.m. The idea is that this event is going to bring together youth, families, and prevention partners. It's going to be an interactive day of learning, discussion, and community connection. They'll have informational tables. They're going to have a youth-led town hall discussion, which I think is going to be very interesting, as well as family-friendly elements like giveaways, raffles, and a lot of interactive activities. So if you're interested or know someone who might be interested in attending, please support Therapeutic Links in this effort. The American Heart Association is hosting their Heart Walk on Saturday, November 1st at the National Mall. So please feel free to register to join this family-friendly 1 to 3 mile walk for a great cause. And last but not least, I think, the health department is hosting their virtual DSMP or diabetes self-management program. It will start on November 3rd, and they plan to meet every Monday online from 4 to 6 p.m. So if you or someone you know is living with prediabetes or type 2 diabetes, please consider registering for this free informative class to learn ways to better live with and manage diabetes. They're also going to take the opportunity to create and practice some action plans. I'm familiar with the diabetes self-management program through other partners that I've had the opportunity to work closely with. It really is a great program. So I encourage everyone to participate or to encourage others to participate. Registration is required because space is limited for each cohort. Are there any other announcements that anyone else would like to share at this time?
You were not kidding when you said that there were a lot. I had no idea. So when I said that there are in my answer to the icebreaker, and I said I know it's fall when there are a lot of events, I didn't even know that this was going to happen.
Yeah,
there are a lot of events.
There are, which is great. It gives us something to do and gives us an excuse to get outside, right? Right. Well, before we adjourn, there was a question posed by one of our other health equity work group members. They were curious if any of you all or any of our partners are doing any work or taking any action around the development plans for the data center in Landover. I think I recently saw maybe a post on social media yesterday that they were postponing that development, but you know, everything on the internet isn't always accurate. So I just wasn't sure if anyone on the call had any update or any information they could share about that.
No, I just know I hear, but I lived in Landover. Matter of fact, it's walking distance from that data center, and I'm hearing residents are fighting to not to get that center. And what I'm hearing, I thought I heard was like due to health reasons, traffic. We have that what's that mall right there, which is a terrible, terrible intersection. So that has a lot to do with the traffic as well. So I don't know.
Okay.
I do know that there is a county task force that
Yeah.
is tasked with like reviewing any other proposals. And thus far, because I think largely because of a lot of the community input, there's at least a moratorium on approving any additional data centers or proposals for now until the results from the task force are published. And if that is my understanding, I could be wrong.
That's great information. I see there's another community announcement. District 47 is having a cookout on September 27th, and District 21 is also doing a health fair. The Health and Wellness Division is launching family-based behavioral treatment program on Tuesday, September 23rd at the Health Department on McCormick Drive from 6 to 7:30. The program addresses childhood obesity, working with the family to promote healthy eating and active living behaviors. At next week's event, we will have the Park and Rec Mobile Unit and nutrition staff present to share resources and information related to healthy lifestyles for children and their family. Please share. Again, lots of great information. Thank you, Taylor and Nympha, for sharing that. All right. Well,
PGHAC and SNAP. I'm sorry.
if nothing else, I'll go ahead and just remind you that our next Health Equity Work Group meeting will be on Thursday, October 16th at 3 p.m. So I look forward to seeing you all there. We'll have some more lively discussion and more to come about our community health improvement process as well. So thank you all so much for your time and attention today. We really, really appreciate it and appreciate all the work that you all are doing in this county to make sure that health equity stays at the forefront of our work efforts and at the forefront of our minds. So thank you all so much. Have a great evening and a great weekend.
Thank you so much.
Thank you. You all do the same.
Bye.
Bye-bye.
Oh my God.